My name is Dr. Mahesh. I am a practicing endocrinologist at Health Roots Clinics located in Vijayanagar. So what are the do's and don'ts for patients with diabetes? All patients with diabetes should do few important things. One is plan a healthy meal, which includes appropriate breakfast at the right time, lunch and dinner at the right time. An important aspect of managing diabetes is to have an early breakfast, especially at around 8 am, which will kickstart the metabolism and hence ensure that the glucose variations are extremely normal and they are not fluctuating to cause more problems. The second part of healthy eating is to take adequate quantities of carbohydrate, protein, fat and lots of vegetables that will give them vitamins and minerals. The third part of healthy eating is to avoid the complex, the simple carbohydrates but consume the complex carbohydrates. The second part of do's is exercise. Any form of exercise is very good, especially the ones that involve aerobics and resistance training. Both will have extremely good impact on their glycemic control and improve their strength. So all patients should exercise, and the easiest form of exercise is actually walking. So walking forms an important part of managing diabetes because it will not only improve the health, prevent cardiovascular disease, hypertension and also reduce the blood glucose levels, so the number of medications will be less. The third part of diabetes is extremely important, is to take the medicines at the right time and also consume the tablets before food or after food depending on what is the type of tablet. The fourth part of diabetes is to check the blood glucose levels at the appropriate time and also do a very important test called HbA1c at every 3 months. The next part of managing diabetes that we have to do is to go for regular checkups and screening. Screening for cardiovascular disease, screening for food problems, screening for eye problems, screening for kidney problems have to be done annual basis, and you can go to any good healthcare setup to get an appropriate evaluation done so that you know what stage of disease you are in and you can prevent the complications. So the important 4 do's are regular exercise, walking in the form of walking, regular meals, appropriate timing, third is proper medicines, and fourth is to take the tablets at the right time and also go for regular checkups. These are the do's. The don'ts are: number 1, never skip a meal; number 2, always be active, don't sit for more than 90 minutes continuously, don't sit for 23 hours a week, ensure that you are always active. Third is don't binge eat, because if you skip a meal and start eating, your sugars will fluctuate, so you will not be able to manage them properly. Even if you eat less, but if you skip a meal and then eat irregularly, that is more problematic than actually eating a proper timed meal. The fourth is do not skip your medicines at any cost. The fifth is do not neglect your blood glucose values. Most patients feel that they are not having any symptoms, therefore I need not go to the doctor or consult a specialist. It is important that diabetes is a silent killer. So the blood glucose value may be high, but you may not have any symptoms. But just because the glucose levels are high, they start damaging the internal part of the body. So sometimes you will feel that you get a foot problem, or you will get a heart attack, or you will get a stroke. So many patients come unknowingly that their sugars were high but they did not have any symptoms and they failed to take action. So never ignore a blood glucose value that is high. So consult your doctor and take appropriate steps.